I'm so delighted that I made it because I was already in Lagos for working with NCDC to develop a risk communication plan to tackle most of the zoonotic diseases that we have. But this is my family, isn't it? Let's give ourselves a good round of applause. When I was reached to talk about male involvement, the elephant in the room, anybody that has known my predilection in terms of investment when it comes to issues of family planning, that I always struggle to make a point that the way we are developed now, I use the Pareto's rule. When I want to talk to people about family planning, I invest 80% of the resources that I have on women and then 20% on the men. And the reason why I do that was based on field experiences. As the country director of IPAS, I never stayed in the office. Almost 55% of my work was in the communities. I traveled the length and breadth of 19 states that were funding activities at the states. So I got a lot of information. And I can share one or two before I say a few more about how else can we engage the men. 2 incidents. We decided to have what we call yearly conversations amongst family planning providers that we are supporting around the country. One key message came out when we were also brainstorming, should we keep investing only in women through community sensitization exercises and all that? And in fact, let me congratulate Form 1. When I see the work Form 1 is doing now, I'm so delighted. Madam, God bless you. Because part of that involvement was the work we did with Form 1. For over an 8-year period, we hired a program officer and embedded her in the leadership of Form 1 to give them opportunity to develop themselves, to do programs and raise money. And I can see that is happening. Congratulations, madam. It's a wonderful work Form 1 is doing. But going back to the message, one of the providers raised his hand and said he wanted to share an experience he had had 3 months before coming to that meeting. A medical doctor, he was sitting in his office, a man and his wife came, and then the request was to remove an IUCD that was in situ. What was the background? The man said to the doctor, for 7 years, I've been doing the thing with my wife and no children were coming. You will think that this man didn't have a child, but this family already had 7 children from that same woman. So the doctor now said, okay, what do you want? He said he wanted that IUCD taken out. Now, you can imagine, I don't know of any man in this country that would want to be peeping into the procedure room, into the vagina, when the doctor was removing the IUCD to make sure that the thing came out. And that was exactly what the man did. So the doctor removed it and dangled it in front of him. He was satisfied. He now left and went and sat in his car. When the lady finished with the doctor, she surreptitiously forgot her bag in the room. When she got back to the car, it was the man that said, where's your bag? He said, oh, my good husband, I'm sorry, I forgot it in the doctor's room. So she ran back, went into the room, and told the doctor, please, I know there is also this other type of family plan they give by injection. Please bring that injection, give it to me quickly. So she received the shot. Of course, you know what she would have taken, went back, and then the man, stupid man, was sitting in his, that he has done his job. So that woman went and took hormonal contraception, long term, a little bit. Now, the reason why I tell this story, why did that woman do that? Because the doctor asked the woman, how did you know that you had to do this? You know what she said? He said, 5 months ago, I was in a community sensitization exercise done by Form 1. And they were giving information about family planning and all that. So you could see that for me, the most important thing is to give knowledge, information, skills, and ability for the woman to make her own choice when it comes to issues of family planning. Even me, an international development expert, a medical doctor of 38 years standing, even my own spouse, when we had 3 children, I say, my hands are up, I don't want any more. She agreed. 5 years later, she said she wanted another one. With all the teaching, isn't it? We had a 4th child. But I warned her, you're going to do the training because I'm not going to spend another 20 million naira bringing up another child. But this is to tell you, at the end of the day, it's important that we empower women with information. But what we're talking today is about the elephant in the room, the man, isn't it? How do we get them involved? My own investments, I think in Efion's final concluding statements, he alluded to it a little bit. My own way of dealing this is the investments we should be thinking about is not just investment in family planning information. It's investment on the man, using things that resonate with men, that make them make critical decisions for their lives. And what are those things? Number 1, show the man how much he can save if he plans his family and limits the number of children he has. Give him a picture that he can even afford to go to Saudi Arabia for his pilgrimage, or go to Israel for his pilgrimage if he's a Christian or a Muslim. Show the man that if he invests again in his wife in terms of education, in terms of training, that woman will have some productive outcomes that will improve the family income, so he wouldn't have to slave himself to death. And I think Diane did say it, show some love. The only way a woman can love her husband and make her feel good is if the woman has time to pay attention to him and not having a baby suckle her breast. How do we also make the women to commit, apart from making them invest and see what they can get? Let us use people whom the men listen to. I think there was also an allusion to it here. If a big politician, that we're able to convince one politician, invest our time and resources in convincing one politician like me, and say to him, go tell the men, the only way I can give you things when I get into office, if I see that you have only one wife or only 2 or 3 or 4 children. If you have more than 1 or 2 or 3 wives, you've lost me. But it's going to be difficult, especially in a northern setting where the man has access to 4 wives. But at least talk about the number of children. They will listen. Let us invest in the clerics. And I can say most people in this room will agree that there has been a lot of investment on getting the clerics to understand what is going on. At least in the AAFP, we have the Interfaith Forum where we have joint meetings with Muslims and Christians to make sure that we're having the same commonality in terms of what do we do. But in concluding my own contribution this morning, it is important also for us to tell everybody in Nigeria, man or woman, that we are in a demographic crisis. We have all the signs. When you see nationals emigrating to other countries, people who have skills, not so bad, because the diaspora economy into Nigeria is about $27 billion every year. But that's not the kind of immigration we're talking about. We're talking about immigration of unskilled young people. Since 2004, somebody like me has been shouting that I developed a presentation I called The Paradox of Our Times. I went around and I was talking that we're in a demographic crisis. In 2006, on the invitation of the Norwegian government, when I sat down with the International Development Minister, the first question he asked me, he said, Dr. Oji, how come every single day 13 commercial sex workers will come into their country from Nigeria? My sisters and brothers here, what is so skilled in commercial sex working? Almost 40% of people who cross the Mediterranean to Europe every year are Nigerians from Africa. A few months ago or weeks ago, we saw plane loads of Nigerians being brought back from Libya. So do we have anything to show that we're not emigrating people who do not have any skills? Then the second one is when nationals start killing nationals. It started as OPC in the southwest, militancy in the south-south, Bakassi and kidnapping in the southeast, ethno-religious crisis on the plateau, and then we had Boko Haram. I remember one of my friends, a top politician called me Ejike. I remember what you used to say. Do we expect more? I say more will come. And then come now we'll have the herdsmen, isn't it? If you look at all those things are all population explosion related. And then the last one, the third one, is the burgeoning youthful population that we have. And I think as we were on the table there, Effiong was sharing, they did an interview, had about 9 accountants. He was shocked at the quality of education that they have. So how do we, if you tell men these shocking details, I'm sure they are going to listen. Finally, we talked about the youth. It's important to invest in the youth, and this is the only place I think where I completely agree. If on issues of family planning, we'll change the Pareto's rule and turn it upside down. 80% should be on our young men. The reason is that for us that are my age in this room, we're no more producing. The people that will drive our population to 400 million in 2015, 2050 are the young people below the age of 20, 25 max. So that is where the message is. Packard Foundation did a survey or an assessment of who was dying in terms of age some years ago. Shockingly, 70% of the deaths coming out of Nigeria were young people below the age of 18. And that's where I end and say, that young 16-year-old, 17-year-old that is leaving your house every morning, bye daddy, bye mommy, very visible, you see her every day, but you're not giving her contraceptive information. Neither are you giving the young man. So what do you expect? They'll bring back an unplanned baby for you, or they get themselves killed trying to terminate a pregnancy they don't want. Thank you.
Yes, if you look at how the conversation went, you can see there are different publics that we need to address their needs. And for me, the focus is on men. How do we involve men? And then you remember that my pitch is that we need to do things a little differently. It's enough that we're telling the clerics to keep talking to the men, but there are some people who do not listen to clerics. And most men make decisions based on their own personal interests at the end of the day. And I know that the most important ingredients that can make people to make decisions are economic. If they see some gain in it, financial or otherwise, then they will start looking at making the lifestyle changes that we desire in terms of family planning. So I think moving out of here, all the NGOs involved in issues of family planning, even the government advocacy units should be thinking of how do we sell family planning in a way that men will see the benefit for themselves first, before even talking about the women. And then also the second resonating theme for me that I also am pushing, just not here, nationally, is the very visible but hard to reach young people. 16, 17-year-olds that are still in school. Every day they say, bye mommy, bye daddy. You don't know what they're doing when they say they're in school. And the Nigerian Demographic Health Survey has shown that the age of sexual debut is about 15, 16. So they were pretending that they are not having sex, but they are already exposed. So how are we going to reach those girls and boys with information services? That is key. And the high time we stop playing ostrich in it, the better. Because if you look around, the people that would drive our population to a 400 million in 2050 are the young people below the age of 25 as we speak right now. So this is so key and it's urgent. And the reason why we must do something now, we're already in a demographic crisis. We're 198 million. Britain was 46 million when they colonized us. We were 56 million as at the time. Britain is just 66 million and we're already 198 million, 3 times our size. So we must do something urgently. And then if we didn't have problems, then it will be different. There are problems everywhere. Starting from OPC in the southwest, militancy in the Niger Delta, Bakassi kidnapping in the southeast, ethno-religious crisis in the plateau, then Boko Haram in the northeast. Now we have herdsmen all over the country, so to speak. These are things showing us that we have a problem with our population. And then also a lot of immigration of our young people out of the country for unskilled labor. And then you can see the burgeoning large population that we have. A lot of people say, yes, if we invest in the population we have now, it will be a benefit for us. But it's easier said than done. We're not even doing what we need to do right now. Where are we going to get the resources to even invest in this large population that we're talking about? And we're not, investment in that is investment in reducing maternal mortality, investment in reducing the unanswered death rate, and the increase in contraception. And then on investment in appropriate and qualified education for our people that will make them also be able to be employable and then having jobs for them. All those things are not happening right now. So we need to really, really bring up our contraceptive prevalence rates. Yes, the association that I chair, the Association for the Advancement of Family Planning, is a conglomeration of NGOs in different areas of thematic work. So we already have that, and that's why we work directly with government. And then coming this year in December, we're going to have our national family planning meeting. We always have it in this hall. So we already have that mechanism, and that's why the coordination from the ministry is easier. We have an umbrella organization that coordinates, and then all the members of the family that do family planning are all members of that association.